Welcome to Adapt NCLEX Fundamentals of Safe Medication. These are high yield information. It's good to know before you take your NCLEX or while you're in nursing school for your clinicals. So we're going to talk about 12 most tested safe medication practice that will help you. Stick around. Let's break it down. I'll show you the key facts. Let's get to it. The first medication is a dose calculation. It's not a trick question. It's a straightforward. It's just in a presentation form of picture, right? Pictorial representation. What do you think? You can calculate this. I know you can do that. An order for what? Morphine 2 milligram. It's available 10 milligram per ml. So every ml has 10 milligram in it, right? How many ml will you draw? What do you think? What do you think? The morphine available is 10 milligram per ml in a vial. So it can be in a vial. So what do you think if you have to give 2 milligram to a patient, how much would you draw? Calculate it. I just want you to indicate it on the diagram. So what do you want to do? Whatever calculation you're comfortable with, just use it. I usually use dimensional analysis. And I said I've been giving what? My ordered dose is 2 milligram. And my available is what I'm going to work with. It's 10 milligram per ml. Since I need to have ml on top, I'll keep the what? 10 milligram down so that they can cancel it out. This 10 milligram, 10 milligram, 2 here go 5. So we have 1 over 5 ml, which is what? 0.2 ml. So the nurse is going to draw 0.2. You just have to indicate here that this is what we're going to give it to the patient. Straightforward, right? You got it. Next question. A nurse is preparing to administer IV vancomycin to a client, which action requires immediate correction. Administering the drug over 30 minutes. Reviewing the client's serum creatinine before infusion. Checking for a history of flushing after the medication. Monitor IV site during the infusion. The best way to answer this question is to go back to what it means. Vancomycin, you know what it is. You have to have the pharmacokinetics idea about the medication. This is medication administration, so you have to know certain few things about the medication. It affects your kidney. You should be running too fast. You get flushing. You got to check your trough and peak before you give it to the patient. So what do you think? Number one, say give it over 30 minutes. 2, say check their creatinine. 3, say check for previous history of flushing, right? And then monitor IV side because it's a vesicant, it's a content level medication administration. So I'll give you the content associated with it. Vancomycin, giving vancomycin over 30 minutes is too fast. This can cause problem. It can cause Redman syndrome. You should give it at least 60 minutes. Reviewing client creatinine is very important because you want to know their kidney function before. If you check for history of Redman syndrome, which is the flushing, it will help you to run the medication so slow. You should monitor the IV side because it causes what? Extravasation, and that can cause problem to the skin, necrosis. Therefore, because it's a vesicant, the right answer that needed correction is number 1. And then receive 4 medication orders, which to the next question. That means wrong medication, wrong order, prescription order is wrong, or the route, or you got to look at it and see, or the dose, there's a contraindication. Warfarin 5 milligram giving PO daily, and the patient INR is 2.5. Penicillin Pro 10 milligram PRN for your blood pressure of 140 over 90. And a dilaudid, which is a morphine, a derivative, opiate, 4 milligram IV push every hour, PRN for pain. Think about it. Metoprolol 50 milligram PO. Patient has a heart rate of PO daily with a heart rate of 58 beats per minute. Think about it. Warfarin, you got to give it daily unless the INR is great, like 4, 5 years. This is not the problem. 2.5, 4 is still within a normal range. Lisinopril 10 milligram given to reduce blood pressure is fine. A morphine opiate derivative given every 1 hour, 4 milligram, that's too much a dose. That can lead to respiratory depression. Metoprolol 50 milligram given is okay for your heart rate daily. Most of the time, this is given for your blood pressure and it will draw it for your heart rate a little bit. So the one that is more serious is a number 3. So that's the one we have to question. Which of the following medications should never be administered via IM route? This is a test-taking strategy. Look at it. IM, something through the muscle. Therefore, why do we give IM medication? We give it because that's the easiest way we can give it to. But what is one of the contraindication when you give IM medication? Do not massage. Why? Because it can cause bruising and bleeding. Well, which of these medication will cause bruising and bleeding? Lorazepam does not cause that. Heparin would do that. Allopurinol does not cause that. Diphenhydramine does not cause that. So this is the reason why we don't give heparin through IM, because it's already anticoagulant and it will cause bleeding. So this medication should never be delivered through a IM route. Number 2 is your right answer. Straightforward. Next one. And then she's teaching the parent how to administer ear drops to their 3-year-old child, which statement by the parent indicate correct understanding. So you have to understand how to administer ear drops. There's technique. I know which one they're going to ask you, and I put it there as an answer. That's the key aspect of ear drop. You have to know that one. I will put it here up and back before giving the drops. I will warm the drops by placing the bottle in hot water. Child on their side for few minutes after drop goes in, right? Use a cotton swab deep into the ear to help the drops absorb. What do you think? Pick an answer. 10 seconds. Stop the video. Answer it yourself and see. Then we break it down. What do? Don't put anything in your ear. So cotton swab is gone, right? The kid is 3 years old. Anybody above 3 will pull the ear up and back. If you 3 and below, we pull it back and down. Therefore, 1 is wrong. To warm it, you place them in your hand and rub it. Therefore, what is left is 3. When you put it, the ear drops in, the kid needs to lay on their side for a few minutes. So 3 is the best answer. And this is preparing to administer IV potassium, bad medication. Which intervention is appropriate? Bad medication. I'll give you the clue. Bad medication, which is potassium, you cannot push it through IV push, right? You have to make sure it's diluted. That's the key. Very, very important. It's diluted, and you have to use a pump. Those are the answers. So administer via IV push in the central line is wrong. Mix it with 50 ml sterile water and infuse over 10 minutes. That's too fast. Use the infusion pump to control the rate. That's perfect. Flush the IV with the normal saline after administration. That means it's the same thing as IV push. You give it and you flush it. It's the same. 4 and 1 are saying the same thing. Test taking strategy. We need to give it through over pump. We need to dilute it, and then no IV push. Number 3, best answer. What should the nurse do first? A client refuses to take a prescribed antipsychotic medication. This is the right of medication. Patient has autonomy. You can decide what you want to do. I'm just giving you the content so that you can use it to answer the question. Therefore, based on that, document the refusal and notify the healthcare provider. Explain the consequences of non-adherence. Attempt to administer the drug later without informing the client. Restrain the client to administer the medication. What do you think? You are the nurse. Based on that, what do you do in that situation? I've given you the content. Patient has right. So if he refuses, that's the end of the story. But you have to document and you have to let the doctor know. You should not explain the consequences of non-adherence. There's no evidence of non-adherence. Just know that you should tell them, you should educate them, but consequences means you worry about things bad is going to happen. You have to explain to them why they need the medication. But this number 1 thing is refusal, document it, then you let the doctor know. You should not give you the medication when they are not aware. They have to consent for that. The client with a PEG tube is receiving multiple medication. Which action by the nurse is correct? I'm testing mixing of medication. And you know that there's an IV form and the oral form. The key is never mix them unless they are compatible. Mix all medication into a single syringe for 60 ml of water. Flush the tube with 15 ml of water before and after each med. Crush the entire coated tablet and dissolve them completely. Oral medication if the residue volume is greater than 100. Test taking strategy. This is our GI content. What do you think? Stop the video and rate, and then you listen to me. What do you think? I told you the buzzword is what? Do not mix them. Most of the time when you mix them, it affects what? Absorption, and it can clog the tube also. Therefore, in order to prevent that, you should not mix them. You should flush to give them individually and flush them with at least 15 ml of water before and after administration. And therapeutic medication should never be crushed. If you crushed it, you get all the dose and you get overdose. And a residual volume that is greater than 100 does not indicate that you should hold on medication. If it's greater than 100, that is fine. Even 200, you have to check for symptoms, whether the patient is having symptoms of absorption. So for now, just by saying greater than 100 is not enough. Right answer, number 2. And this is teaching a client how to properly administer prescription ear drops. I took a couple of medication routes that I think is likely where most people are not familiar with ear drops and eye drops. So we have eye drops at home. Which statement by the client indicate a need for further teaching? That means we got to provide some further teaching. So how do you administer this medication and what is the proper way to do it? I will tilt my head back and look up before putting the drop in my eye. Yes, you look back so that and then you can look at the lower eyelid. I will pull down the lower eyelid and place the drop in the conjunctival sac so that it can stay there in the middle. Yeah. I should avoid blinking and squeezing my eyes tightly right after the drop because it will push the medication out. I will apply the drop directly into the eyeball so that it can absorb faster. That is wrong. When you put it on the cornea, it causes irritation right away. And you try to squeeze, reflexly, you try to squeeze your eyes and you pop the medication out. It make it ineffective. So don't put it there. Put it in a conjunctival sac. Therefore, which one need further intervention? Number 4. Number 10, which scenario indicate an unsafe medication? Unsafe medication means the scenario is bad. A nurse administer a start medication before documenting. A nurse administers ceftriaxone IV and then flush the line. A nurse gave a medication prepared by another nurse. A nurse verifies 2 patient identifier before giving the medication. Number 4 is normal. At least 2 is good. Yeah, name and date of birth, right? You never give any medication to any patient if not prepared by you, or you do not handle it yourself. Antibiotic after giving need to be flushed. The start medication means the start medication. You don't need to document before you give it, before you document. So number 3, wrong answer. And then she's teaching a client about the safe use of what? Transdermal patch. That means transdermal, going through the fat on your skin. Which of the following statements indicate understanding? Think about it. I'm giving the medication through the skin. Therefore, that contact spots, that contact area should be clean as much as possible. I will apply the patch to the clean, dry, airless area. Yeah, there's no hair. It's clean. It's not shaved though, and can help with absorption and stick. You should not shave it. I will cut the patch in half if the full dose is too strong. Cutting, manipulating the patch increases the absorptive effect, and that will release a bunch of medication that will cause overdose. Don't do that. I should rotate patch site with each application to prevent irritation. Apply heating pad to the patch. That will cause more absorption. Don't do that. I will fold the patch and flush it down the toilet when I remove it. This is also a misnomer. It's a problem people make all the time. You shouldn't do that. The patch should be properly disposed, not in your toilet. I should report difficulty breathing and excessive drowsiness immediately. These are side effects. Therefore, which one indicate correct understanding? Number one, indicate correct understanding. Number three, rotating the patch. And number six, indicating correct understanding. Those are the ones that we need to pay attention to. And the last one, IM medication, key concept to know. This is one question as everything you need to know. So which actions are appropriate? Do you know how to inject IM medication, or do you have a concept associated with it? We're going to use at least 1.5-inch needle for IM because it's deeper, right? Aspirate before injecting vaccine into the deltoid muscle. No aspiration, right? Administer the injection at 90 degrees. That's the correct angle for administrating of IM medication straight. Massage the skin site after giving a depot medication. This can cause what? Hematoma and bleeding. Choose the ventrogluteal site for large volume irritation medication. This is the good side for what? IM medication, because it prevents what? IM medication because it prevents the injury to nerves. So this is the best way. And the last one, use the zigzag method when injecting iron dextrose. This will prevent hematoma, you allow absorption, adequate time for absorption of the medication. 12 medications, 12 administration, 12 specific technique that is useful if you're in nursing school or preparing to take the NCLEX to know them. IM medication, patch medication, oral medication, and good luck in your exams.